It's now time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Of course, South Korea is clearly seeing a decline in COVID-19 cases, with figures now under 100,000 on almost a daily basis.
However, with almost all social distance measures lifted and new subvariants being reported throughout the country, some are worried that the country could see cases start to rise again. For a look at South Korea's COVID-19 situation, we, as always, turn to Dr. Alice Tan, internist at MizMedi Women's Hospital. A very good morning to you, Dr. Tan.
Good morning.
Thanks for joining us on the phone here. And well, first off, South Korea has downgraded the level of the disease from 1 to 2 as of Monday, saying that it's less infectious than before. And people are now allowed to eat indoors. But what is your assessment of the situation? Are we prepared for this? Would you say that the worst is really behind us?
Well, first of all, the virus is not more infectious than before. It's more infectious, but it's less virulent because so many people have received vaccination. Currently, we're about 75% down from the peak of the Omicron curve. And across the board, we continue to see improvements in new daily cases, new admissions, current ICU cases, and most importantly, in new COVID deaths. I think that we can say that we are safely beyond the worst of the Omicron wave. The BA.2 subvariant of Omicron claimed dominance during the 4th week of March. And despite that, and also the fact that we have lifted all social distancing measures, cases have been steadily declining since the last week of March and also since last week. The 7-day average for daily COVID deaths, however, if we want to look at this from a different perspective, is now about 150, which is actually 41 more deaths than our highest number of deaths pre-Omicron. So even though we may feel good about our current situation, if we look at it in terms of a broader perspective, we're much worse than we were pre-Omicron at our peak of Delta. My biggest concerns are that the BA.2 subvariant is in wide circulation. It is now the dominant strain, as I said, and there's some evidence that it may be causing more severe disease in children. Certainly here in Korea, we are seeing a disturbing trend in increased child death due to COVID-19. As of March 25th, there were 11 cumulative deaths among children and adolescents between the age of 0 to 19. However, over the course of only 1 month between March 25th and today, 15 more children died due to COVID-19. In other words, there were more pediatric deaths during the last 1 month alone than during the entire 27 prior months of the pandemic. And so I think the future is uncertain in terms of what might happen with the pandemic. But in terms of the Omicron surge, I think the worst is behind us.
Yeah, I think one of those things where I don't think is really getting reported enough is the child death. But despite all this, I mean, South Korea has long been sort of praised for what they're calling the K-quarantine measures. Dr. Tan, what would you say was the biggest factor in Korea's successful fight against COVID-19?
I think it was a team effort that was the most successful part of countering the pandemic in our country. And if I could identify the 4 team groups that were really the heroes, I think in our country, the first would be the medical professionals and the public health officials who have been working around the clock for more than 2 years to keep as many people alive and to keep the country safe. Secondly, the public has been phenomenally compliant with all public health guidelines and recommendations, including receiving vaccinations, distancing when needed, and masking up. Third, I think the media did a great job acting as messengers and delivering fact-based news. There's so many places where misinformation played a detrimental role in the pandemic. And lastly, the biomedical industry really stepped up to produce all of the testing kits and masks and vaccines that not only Korea, but also the world needed as well.
And Dr. Tan, there are now still concerns over these Omicron subvariants that are popping up here in the country, the XM variant that was reported last week. First of all, what kind of characteristics does the XM subvariant have? And also, as we hear of these subvariants and new variants emerging, is the medical system here in Korea becoming better prepared to really handle these new variants? I mean, the concern always is that the medical system, the healthcare system, might be overwhelmed by a sudden resurgence.
So far, there is a dearth of information on the XM recombinant variant. What we do know is that it's a combination of the BA 1.1 and the BA.2 subvariants. And according to one source, greater than 30 cases have been discovered in 8 countries. Otherwise, there are not yet good data on the transmissibility or the virulence of the XM strain. In terms of are we ready for healthcare readiness, we survived Omicron. So if there were a new variant similar to Omicron, I think we will be in a better position to deal with it. But the problem is we've decreased the amount of testing that we're doing. Therefore, genetic surveillance has also been decreased. And that's what you need to pick up new variants. And so that's my biggest concern is in terms of testing, our testing robustness and reliability have gone down.
Yeah, hopefully with the ease measures that we're going to be seeing all the more, I think most important thing is that we are not too lax, because I think the fight against COVID-19 is still far from over with. Dr. Dunn, as always, thank you very much for your insights, and we'll, of course, speak to you again next week.
Thank you.